Hello and welcome to this edition of Health and Medicine News. I am Patricia Elizabeth Jacobs. To combat acute shortage of doctors in rural areas, the central government has come up with a unique 3.5-year bachelor course in medicine and surgery for students from villages. These doctors will not be allowed to practice in urban or semi-urban areas. Once the rural doctors get their degrees, they will be allowed to practice only in notified rural areas. To ensure this, the Medical Council of India or MCI would renew their practicing license on an annual basis, that too on submission of a certificate from the District Health Officer. At present, the sub-centers are handled by the auxiliary nurse and midwives or ANMs, and there are no doctors to man them since they prefer to work in urban areas. These doctors will work in rural areas and district hospitals with specified bed capacities and can be utilized as medical schools for these courses, said the Health Minister, Mr. Ghulam Nabi Azad. According to Dr. Ketan Desai, President of MCI, this will provide an opportunity to children of villagers to get into the medical stream. The rural medical course has been almost finalized by the MCI and is likely to be discussed in a conference with Vice-Chancellors of universities and health secretaries on February 4th. In rural areas, doctors can handle common ailments like asthma or abdominal ailments. They can also attend to normal child delivery, but they will not conduct surgery or look into complicated cases. The government will begin by picking up 25 students from each of India's 300 districts which do not have medical colleges. The new MBBS course has been tailor-made to suit the rural requirements. Occupational therapy is a treatment that focuses on helping people to achieve independence in all areas of their lives. For the promotion and the growth of occupational therapy or OT, a health Mela was organized at Bal Bhavan, Delhi. Our correspondent Namika Sinha talked to the representatives of different stalls at the Mela about the role of OT in different problems and their treatments. Ms. Pranita, who is studying occupational therapy, tells us the details.
Occupational therapy is the art and science of directing man's response to selected activities that will promote health, prevent dysfunction and disability, and maximize independence of each and every individual. It also creates skills for living.
Some people face problems in their activities of daily living.
I am Shikha Luya. Basically, ADL stands for Activities of Daily Living, and when we talk about occupational therapy means whatever keeps you occupied. Whatever our ADL is, it basically keeps us occupied for some time of the day. So when we talk about ADL, there are certain disabilities, certain problems that will not let you do them completely in 100%. For example, if you have children who have disabilities from birth, they are not able to do anything for themselves, and the mother has to take care. So child of say 5 years is able to wash himself, bathe himself, but a child with the disability of 5 years will not be able to do what is required of him. So that is where occupational therapy comes into role. We teach the child, we teach the mother also. How can the child help the mother in doing his own work, and slowly with treatment, how can the child do his own work? Now that can be done only while treatment, or we can give him devices, which we call adaptive devices, which the child can use himself to do his ADL, which will lessen the burden on the mother, on the caregivers, and the child can become independent and a productive part of the society. Similarly, in orthopedic problems where you have joint pains or you have paralysis, we train the persons how to do their own work without taking help from others or taking very minimal help. That is the role of occupational therapy in ADL.
Ms. Sheila from Tata Nehru Bal Chikitsalaya Hospital says that OT plays an important role in orthopedics.
The role of occupational therapy in orthopedic cases are basically when they are going through some surgery. After that, for the strengthening program and to come back with the daily ADL routine work, that is the main goal of occupational therapy. So in the orthopedics, and when we see the cases of basically replacement, so how the patient do with their ADL work, ADL means basically the activity of the daily living, which basically patients have problem in that. So how to overcome with that difficulty is the main goal of occupational therapist in that. And I think when we want somebody independent, so the role of occupational therapy comes first in that.
Dr. Sonia from Indian Spinal Injuries Hospital discussed about the computer workstation and what is the right posture of sitting while working on the computer.
What is the right posture to sit in is the 90 degrees in neutral position. The spine should take the natural CS-shaped curve rather than sitting in a kyphotic or a lordotic posture. There should be frequent changes in posture. You should not sit on computer for more than 20 minutes, you need to take a 5-minute rest break after the 20 minutes of workout, and then you can have the exercises protocol at your workstation. If you're using a phone call, your posture should not be extreme of lateral flexion. You should maybe use a headgear or a speaker, and also your phone call should be short and sweet.
Dr. Ruby Ikat, the lecturer of neurology, says that after any surgery or after the medications comes the role of occupational therapist.
The role of occupational therapy in neurology is that whenever there is a neurological disorder in any patient, neurological disorder means any disorder that is related to the nerves or muscles or brain or spinal cord. Now, after surgery or after the medications or after the medical treatment comes the role of the occupational therapist. Now, the role of the occupational therapist is ultimately in the complete rehabilitation of that patient. Now, if the patient is not able to walk, if the patient is not able to write with his hands, if the patient is not able to feel the sensations, here comes the role of occupational therapy. So basically we have different modalities, we have different types of treatments specifically designed for the neurologically disabled people. Now this includes the head injury, the traumatic brain injury cases, the spinal cord injury cases, Parkinson's disease, epilepsy, then children who are born with mental disorders. This includes all those conditions.
That wraps up this edition of Health and Medicine News. Let's get back to the news studio.